Ovarectomy and ovohysterectomy. For an unwanted pregnancy, do an ovarectomy for prevention and an ovohysterectomy for treatment. For pyometra, do an ovarectomy for prevention and an ovohysterectomy for treatment. For uterine neoplasia, do an ovarectomy for prevention and an ovohysterectomy for treatment. For other uterine abnormalities, do an ovohysterectomy for treatment. For mammary gland tumours, do an ovarectomy for prevention and treatment. For ovarian abnormalities, do an ovarectomy for prevention and treatment. And for diabetes mellitus, do an ovarectomy for treatment. The risks are hemangiosarcoma, osteosarcoma, and traditional cell carcinoma, and prostate adenocarcinoma, and obesity, diabetes mellitus and hypothyroidism, and cranial cruciate ligament rupture and hip dysplasia. It's best to do during anestrus, not during diestrus, as this can cause iatrogenic pseudopregnancy. Except after pregnancy, it's okay to do a spay after estrus. The spay should be done after the second estrus and before they're 2.5 years old. This decreases the risk of mammary gland tumours. A preputral spay increases the risk of urethral sphincter mechanism incompetence, juvenile vaginitis, and ortho problems. A dog that is under 10 kg should be spayed at 6 months. A dog that's between 10 and 20 kg should be spayed at 6 to 8 months. A dog that's between 21 and 30 kg should be spayed at 9 months to 12 months. And a dog that weighs between 31 and 40 kg should be spayed at 10 to 14 months. And a dog over 40 kilograms should be spayed between 1 year and 2 years. The reason you delay the spay for large dogs is because it decreases the incontinence risk. For general anesthesia, do fentanyl, midazolam, and ketamine. This is for the pre-medication. For the induction, we use propofol, and for the maintenance, we use isoflurane. For post-operation, we give meloxicam and antibiotics. For an ovohysterectomy, we can give ketamine, xylazine, and diazepam for the pre-med and induction, and for the maintenance, we have ketamine, diazepam, and isoflurane. For the procedure, have the animal in dorsal recumbrancy. In a pre-butral queen, the possibility to do a trendium position. Make the incision along the linea alba. Retract the intestines and find the uterine horn with fingers, and then exteriorize the ovary. For an ovarectomy, do 2 ligatures on the uterine tip and the mesoovarian at the meeting point between the bursa and the suspensory ligament. For an ovohysterectomy, there are 3 ligatures, 1 mass ligation, which is caudal to the cervix, and 2 ligatures for the uterine artery. Then you cut and check the stumps for bleeding, and you close the abdomen in 3 layers. Complications include bleeding from the stumps, the broad ligament, or pyometra, or suture abscesses.